Have you ever felt that your feet seem a little different lately, but you are not quite sure why? There is no clear pain, no obvious swelling, but something just feels off. Maybe it is a light tingling that comes and goes, or your skin feels drier than usual, or a small scratch that takes longer to heal. And most of us would think it is just age, or maybe we have been walking too much, or it is nothing serious. But sometimes, the truth is not that simple. In many cases, these small changes are early signals from your body warning you that something inside is slowly changing, a condition that many people only discover when it has already progressed much further. That condition is related to blood sugar, and more specifically, diabetes. What most people do not realize is this: long before any blood test shows a clear result, your body has already been trying to speak to you. And one of the first places it speaks is your feet, the part of your body you use every day, but rarely take the time to really observe. I've spent many years working with older adults, and what concerns me the most is not just the disease itself. It is how many people had early signs for a long time, but did not recognize them. I remember one patient in his early 60s, living a normal life, eating regularly, and feeling generally fine. He told me that his feet sometimes felt slightly numb, like small ants crawling under the skin. But it only lasted a short time, so he ignored it. He also noticed that his skin had become a bit dry, with a few small cracks. He thought it was just the weather. Then during a routine checkup, his blood sugar levels came back high and had likely been elevated for quite some time. Those small signs in his feet had appeared long before that moment, but because they felt so normal, so harmless, he did not pay attention. And this is not a rare case. Many people go through the early warning stage without ever realizing it. Only when complications appear do they begin to worry. And by then, managing the condition becomes much more difficult. That is why in today's video, I want to share something very important with you. 9 signs that can appear in your feet that many people believe are normal, but may actually be connected to blood sugar. For each sign, I will explain why it is often misunderstood, what is really happening inside your body, and one simple thing you can start doing today. Especially, some of the signs toward the end of this video are very common, but almost never linked to diabetes by most people. So I encourage you, stay with me until the end, because recognizing even one of these signs early can help you take better care of your health. And right now, let me ask you something simple. Recently, have your feet shown any small changes that made you feel a little unsure? If yes, just keep that in mind. Because what you are about to hear next might help you understand your body in a way you never have before. Now let us begin with the first sign. Sign number 1, a light tingling sensation in the feet. Many people believe this is completely normal, especially as they get older or after sitting in one position for too long. They often say, "My foot just fell asleep. It will go away." And yes, sometimes that is true. But when this sensation starts happening more often, without a clear reason, that is when you need to pay attention. What is actually happening inside your body is that your nerves are beginning to react to changes in your blood sugar levels. Over time, excess sugar in the bloodstream can start affecting the outer layer of your nerves. Think of your nerves like electrical wires. Each wire has a protective coating that allows signals to travel smoothly. When that coating becomes slightly damaged, the signals become unstable. That unstable signal is what you feel as tingling, or pins and needles. It may come and go, and that is exactly why most people ignore it. A simple habit you can start today is gentle daily movement. A slow walk or light stretching of your feet and ankles helps improve blood flow and supports your nerve health. Sign number 2, your feet feel tired, even when you have not done much. Many people assume this is just part of aging. They think, "I'm getting older, of course my feet feel weaker," but sometimes the cause is not just age. It may be related to how well blood is circulating through your lower body. When blood flow becomes less efficient, your feet do not receive enough oxygen and nutrients. As a result, even small activities can make your feet feel unusually tired. Imagine a road that is slightly blocked. Cars can still pass, but much slower than before. Your blood circulation works the same way. When the flow is not smooth, your feet begin to feel heavy and fatigued. A simple thing you can do is move your ankles regularly. Rotate your ankles, lift your heels, stretch your toes. These small movements can help improve circulation and reduce that tired feeling. Sign number 3, the skin on your feet becomes noticeably dry. Most people will blame the weather. They say, "It is just the dry season," or "I need more lotion." And sometimes that is correct. But when dryness becomes persistent and does not improve easily, it may be something deeper. Your body has a system that controls moisture in the skin. When that system is affected, your skin begins to lose its natural balance. In some cases, this is connected to how your nerves are functioning. When certain nerves are not working properly, the skin may not retain moisture the way it should. Think of your skin like a surface that needs water from within. If that internal moisture is reduced, the surface becomes dry, no matter how much you apply from the outside. That is why some people use lotion every day, but still feel their skin is not improving. A helpful habit is to drink enough water throughout the day. At the same time, you can gently moisturize your feet in the evening, especially the heels. But remember, healthy skin starts from inside your body, not just from what you apply on the surface. Sign number 4. Changes in the color of your skin around the feet or ankles. Many people assume this is just normal skin variation, or maybe sun exposure, or simply aging. They may notice that the skin looks slightly darker or more reddish, especially around the ankles, but they do not think much about it. However, when these changes appear gradually and become more noticeable over time, it may be a signal that circulation is not working as efficiently as it should. Your blood carries oxygen and nutrients to every part of your body, including your feet. When blood flow becomes reduced, the skin does not receive what it needs to maintain its normal appearance. As a result, the color can change. Sometimes it becomes darker, sometimes slightly red, or even with a faint bluish tone. Think of it like a delivery system. Your blood is the delivery truck, and your feet are at the end of the longest route. If the roads become narrower or slower, deliveries do not arrive on time. The skin begins to show signs of that delay. Another thing you may notice is that the skin feels thinner or more fragile in those areas. That is because the tissue is not being nourished properly. A simple habit that can help is improving circulation through gentle daily movement. Ankle rotations, toe lifts, and light stretching in the morning can make a meaningful difference over time. Even small movements done consistently help keep blood flowing to your feet. Sign number 5, small cuts or blisters that take longer than usual to heal. Most people think a small wound is nothing to worry about. They expect it to heal on its own, within a few days. And in many cases, that is exactly what happens. But when a minor cut, a blister, or even a small crack in the skin stays open longer than expected, it is something you should not ignore. Healing is a process that depends heavily on healthy blood circulation. Your blood brings oxygen, nutrients, and immune cells to repair damaged tissue. When blood sugar levels are elevated over time, this process becomes less efficient. The tiny blood vessels in your feet may not deliver enough of what is needed. As a result, healing slows down. Think of it like trying to repair something, but the tools and materials arrive late. The work takes much longer to complete, and during that time, the wound remains exposed. That creates an opportunity for infection. Even a small injury can become more serious if it is not healing properly. A very important habit is to check your feet regularly. After a shower or before going to bed, take a moment to look at your feet carefully. If you notice any wound that is not improving after a couple of days, it is best to take it seriously. Early attention can prevent much bigger problems later. Sign number 6, a burning or uncomfortable sensation in your feet, especially at night. Many people describe this as a strange heat, or a feeling like their feet are warmer than the rest of their body. Some believe it is due to fatigue, or being on their feet all day, and sometimes that is true. But when this sensation appears regularly, especially when you are resting or trying to sleep, it may have a different cause. Inside your body, your nerves are responsible for sending signals between your brain and your feet. When these nerves are affected, they can begin to send incorrect signals. Instead of reporting normal sensations, they may send signals that feel like burning or discomfort, even when there is no external heat. Think of it like an alarm system with a faulty sensor. The alarm goes off even though there is no real danger. The signal is real, but the source is internal. That is why this sensation often becomes more noticeable at night, when everything is quiet and there are fewer distractions. A helpful habit for this is maintaining stable blood sugar levels through daily choices. Drinking enough water and including more fiber in your meals can support your body in regulating how sugar is processed. At the same time, gentle foot stretching before bed can help relax the nerves and improve overall comfort. Sign number 7, frequent muscle cramps in your feet or lower legs, especially at night. Many people immediately think this must be due to a lack of calcium, or maybe they have been walking too much during the day. And yes, in some cases, muscle cramps can be related to fatigue or mineral imbalance. But when these cramps happen often, especially at night and without a clear reason, it may be linked to how your nerves and circulation are working together. Your muscles depend on signals from your nerves to contract and relax properly. At the same time, they depend on a steady flow of blood to supply oxygen and nutrients. When blood sugar levels have been elevated for a long period, both of these systems can be affected. The nerves may send irregular signals, and the blood flow may not be as efficient as before. As a result, the muscles can suddenly tighten without warning. Think of it like a system that has lost its rhythm. Instead of smooth, controlled movement, the muscles react suddenly and unpredictably. That is what creates the sharp, uncomfortable cramp that can wake you up in the middle of the night. Another reason this becomes more noticeable at night is because your body is at rest, and there are fewer distractions to mask the sensation. A helpful habit you can start is gentle stretching before going to bed. Focus on your calves, your ankles, and your toes. Slow, controlled movements can help relax the muscles and improve blood flow. Staying hydrated throughout the day also plays an important role because your muscles need proper fluid balance to function smoothly. Sign number 8, your feet feel consistently cold even when the environment is warm. Many people say, "I have always had cold feet, it is just my body type." And in some cases, that may be true. But when your feet feel cold regardless of the temperature around you, even under blankets or during warm weather, it may be a sign that circulation is significantly reduced. Your blood is responsible for carrying warmth throughout your body. When circulation is healthy, warm blood reaches even the smallest areas, including your toes. But when blood vessels become narrower or less flexible, the flow of warm blood is limited. As a result, your feet may feel cold, even when the rest of your body feels comfortable. Think of it like a heating system in a house. If the pipes become narrow, the heat cannot reach the farthest rooms. No matter how much you increase the heat, those rooms remain cold. Your feet are like the farthest room in that system. They are the last place for blood to reach, so they are often the first place where circulation problems become noticeable. A simple and effective habit is regular walking. Not just slow movement, but a steady, purposeful walk that encourages blood to move through your legs and feet. Even 10 to 20 minutes a day can make a difference over time. The key is consistency, not intensity. Sign number 9. A gradual loss of hair on your feet or lower legs. This is one of the most overlooked signs because it does not cause any discomfort. Most people do not even notice it until someone points it out. They may look down and realize that the hair on their lower legs has become thinner or has disappeared in certain areas, and they often assume it is just a natural part of aging. But in many cases, this change is related to long-term circulation issues. Hair follicles require a steady supply of oxygen and nutrients to grow. When blood flow is reduced over time, these follicles no longer receive what they need. As a result, hair growth slows down and eventually stops. Think of hair follicles like small plants. They depend on a consistent supply of water to survive. If that supply is reduced, the plants do not disappear overnight. They slowly stop growing until they are no longer visible. That gradual change is what makes this sign so easy to miss. But it can be a clear indicator that blood vessels in the lower part of your body are not functioning as well as they should. A simple step you can take is to pay closer attention to changes in your lower legs and feet. If you notice a clear difference compared to before, it may be worth discussing with a healthcare professional. Early awareness can help you take action before more serious complications develop. We have just gone through 9 different signs that can appear quietly on your feet. 9 small signals that many people see every day, but rarely connect to something deeper. And I want to say this very clearly. These signs are not meant to scare you. They are meant to give you awareness, because your body is always communicating with you. It does not suddenly become sick overnight. It changes slowly, step by step, often in ways that are easy to miss. And the truth is, most serious conditions do not begin with something dramatic. They begin with something small, something subtle, something that feels easy to ignore, a little tingling, a bit of dryness, a small wound that takes longer to heal, things that seem harmless until they are not. What makes the difference is not whether these signs appear. What makes the difference is whether you notice them and what you choose to do next. Because early awareness gives you options. It gives you time. It gives you the chance to take action before the condition becomes harder to manage. And in many cases, simple daily habits can make a meaningful difference. Not complicated treatments, not expensive solutions, just small, consistent actions. Walking a little more each day, paying attention to what you eat, drinking enough water, taking a few moments to check your body instead of ignoring it. I want to ask you to do one simple thing tonight. Before you go to bed, take just 30 seconds. Sit down and look at your feet. Look at the skin. Look between your toes. Notice if there is anything different, any dryness, any change in color, any small wound, any unusual sensation. You do not need any special equipment. You do not need any complicated test. Just your attention, because sometimes awareness is the first and most important step. And if you notice even one sign, do not panic. But do not ignore it either. Take it seriously. Consider checking your blood sugar. Have a conversation with your doctor. The earlier you understand what is happening inside your body, the easier it is to manage. And more importantly, the more control you have over your future health. You have worked hard your entire life. You have taken care of your family. You have built everything step by step. Your health is what allows you to continue enjoying that life, to stay independent, to move freely, to wake up each day with energy. Do not let something silent take that away from you simply because it went unnoticed. Now you know what to look for. And that knowledge is powerful. But knowledge only matters if you use it. So take that first step. Start paying attention. Start making small changes. Start today. And if you found this video helpful, I would like to ask you for something simple. Share it with someone you care about. A parent, a friend, a neighbor, someone who may also be experiencing these signs without realizing what they mean. Sometimes one piece of information shared at the right time can make a real difference in someone's life. And if you would like to continue learning simple, practical ways to take care of your health as you get older, I invite you to subscribe to this channel. Every week I share information that is easy to understand and easy to apply. Things that are not always talked about but truly matter. Because taking care of your health does not have to be complicated. It just needs to be consistent. And you do not have to do it alone. We can do it together, step by step. Thank you for taking the time to listen today. Take care of your body, stay aware, stay proactive, and I will see you in the next video.